I'm Catheterization, student nurse of Adventist University of the Philippines, and today I'm going to show to you a return demonstration of performing a urinary catheterization in my patients. So the first thing that we will do is, of course, check the chart of our patient. Okay, so I have here Mrs. Cruz, 32 years old. I can also see her birth date in here, also her medical number. And I am looking at her health history. I can't see any records of her allergy in latex products or iodine solution, betadine. So it means that I can use this kit that I have here. I can see here that she already performed a perineal care routine, okay, done by the other nurse. Okay, so now that everything are all set, I'm now going to show to you the equipments that I will be using. Gather the equipment. So the equipments that I will be using is, of course, our urine bag and our urethral catheter kit. Okay, so I think I am good to go. I can now go to my patient. Knock, knock, knock. Good morning, Mrs. Cruz. Yeah, I'm Catherine, a student nurse who will be working with you today. Okay, so how are you doing? Okay, very good, perfect. Before anything else, Mrs. Cruz, I would like you to state first your first name and your surname. Okay, how about your birthday? Perfect, okay, thank you. Can I see your wrist just to check your, okay, name tag? Okay, thank you very much. Mrs. Cruz, I got an order from your physician that I need to perform you and provide you a urinary catheterization, okay? And in that procedure, I'll be inserting a catheter inside your vagina and then let it sit inside your bladder, okay? So to provide your don't worry, because to provide your privacy, I already closed the curtain and also the door and turn on your privacy, and also provide you an adequate lighting. And before we start, Mrs. Cruz, do you have any questions or concerns? Okay, so if there is none, I'm now going to start the assessment. Again, wash my hands. Okay, so Mrs. Cruz, I need you to position in a lithotomy position. Okay, in positioning the patient, you have to position her in a supine position like this, and then flex her legs, her knees up. Okay, and then her legs at least 2 feet away from each other. Okay, so assuming that she is already in a lithotomy position, okay, I'm now going to start the assessment. Okay, start the procedure by opening the urine bag. Place the tube near to your reach. Okay, don't remove the tubing yet. And then start opening the kit. Okay, so in opening the kit, I am aware, make sure that you're aware that all the equipments inside are all steriled. Okay, discard this. Okay, so we need to apply the unpacking and maintaining the sterile field. Okay, leave 1 inch on every side of the cover. Now get the drape and place it under the buttocks of the patient. Make sure to maintain the sterility of the drape. Okay, Mrs. Cruz, I need you to lift your buttocks gently. Okay, while I am placing this underneath your buttocks. Okay, Make sure not to touch the center of the drape. Okay. Okay, still assuming that the patient is in a lithotomy position. Now I'm going to apply the gloves, which is also sterile. Okay, discard the wrapper. And then now that I am already wearing the sterile gloves, I can now have the access on the equipments inside the kit. Now place the tray with the container. Open the lid of the container. And then saturate the 3 cottons with betadine solution. Okay, saturate the 3 cotton balls. Okay, once done, open the lubricating jelly. Okay, it's already open. And then also open the catheter. Discard. And then test the balloon. It is working. Okay. Now I can see that it is working. Now ready to lubricate the catheter. And then place the end of the tubing on the tray. Okay, and then place the sheet on the meatus and then prepare cleaning the meatus. Using your forceps, okay, pick the cotton balls with the betadine, and using your non-dominant hand, hold the upper meatus and then clean the left side first. Okay, then maintain the sterility of the field. Discard the other side. Okay, in the middle. Okay. Okay, so Mrs. Cruz, I need you to, okay, I'm now going to insert the catheter. But this time I need you to take a deep breath and then exhale slowly as I insert the catheter, okay? Okay, now inhale, exhale. I'm now inserting the catheter. Okay, wait until the urine flows on the tubing. Okay, when you see that the urine flows on the And the tubing, insert, advance 2 inch, then inflate the balloon. Okay, you can feel pressure inside, but it is okay. Please tell me if you are feeling discomfort. Okay. Test if the tubing is already placed. If it is already locked, then if it is locked, okay, hold with your non-dominant hand. Hold the tubing with your non-dominant hand. And then discard this. And then attach the tubing on the catheter. Then observe the flow of the urine. Okay. And then secure the tubing on the inner thigh of the patient. Okay, so Mrs. Cruz, I am placing the tubing on your thigh, so it will be secured. Then check the bag. Okay, and then place the bag beside the bed of the patient. Okay, or on the abdomen of the patient so that she can easily walk even the catheter is still attached on her. Okay, so now assess if there are any problems with the flow. If none, you can now discard the rest of the equipment. Okay, so Mrs. Cruz, you did great. Okay. Okay, how are you feeling, Mrs. Cruz? Okay, that's good. Okay, collect specimen if necessary. Okay. Now, okay, Mrs. Cruz, I placed the call light at your reach, so you can easily call me if you need help, okay? Okay, excuse me, I need to get the drip. Okay. Okay, thank you very much, Mrs. Cruz, for your cooperation. You did very well. Okay, so are you not comfortable? Okay, so do you feel any discomfort? Okay, if that's so, then it's good. Now I'm going to... Okay, so how are you doing, Mrs. Cruz? Okay. Okay, do you feel any discomfort? Okay, that's good. So now I'm going to proceed to the documentation. Okay, once done with the documentation, you are now good to go. And that is how you perform a urinary catheterization.